I guess it's a time now, so we have to start right now. Um, Thank you all for coming. I hope everyone can hear me well.
Very
Please, can
well.
I get the response?
Yes, we can. Good evening.
Okay.
Yes,
Yeah.
we can hear you.
Good evening, everyone, and this is a special welcome to this webinar program in honor of World Hepatitis Day. My name is Akinyemi Bright Bayonli, and it is a very great pleasure to be your host and the moderator for today's event that we have titled From Crisis to Conquest, the Decisive Battle Against Viral Hepatitis. So, yeah, World Hepatitis Day, it is a very vital occasion that comes up yearly because it allows us to kind of come together to raise awareness about viral hepatitis. These are a group of infectious diseases that affect millions of people worldwide. Today, we aim to educate, to inform and empower communities with knowledge and prevention, early detection, treatment options that are available to combat this serious public health issue. So, the theme of this webinar, From Crisis to Conquest, is reflects our journey in tackling the challenges that are posed by viral hepatitis. So, we have carefully selected this theme to emphasize the critical need for a coordinated and decisive response to the crisis of these hepatitis infections. We will explore the current state of hepatitis. We discuss the advancements in medical treatment and in prevention, and we also highlight the importance of education and community engagement in overcoming this public health challenge. So, our goal is to transform the fight against hepatitis from a crisis into a conquest in order to pave the way for an healthier future. So, our organization, Alliance for Global Infectious Disease, is dedicated to fighting infectious diseases and promoting health consciousness. We strive to educate the public, reduce stigma, and ensure access to prevention and treatment. So we are thrilled to have you join us today, and we continue. And as we continue on our mission to eradicate this burden, and before we begin and go into the actual thing for today, I would like to acknowledge and extend our very sincere gratitude to our partner, Cytobis Medical Limited, for their support in making this event possible. We are committed to making a positive impact on public health. I hope everyone can hear me.
Yes, I can
Okay.
hear you.
Yes,
Can
we
I
Loud
can
and
get
clear.
a
I can hear.
response?
Yes, I can hear you.
Okay, thank you very much. So, as I was saying, I thank our partner, Cytobase Medical Limited, for their support in making this event possible. Together, we are positive in making impact on public health and raising awareness about viral hepatitis and all other forms of infectious diseases. So, today's webinar will feature a comprehensive lecture by our distinguished speaker, Mr. Ebenezer Odewale. Then it will be followed by a question and answer session. So please, as the lecture is going on, try and get your questions down. There will be a session to answer them later. So you'll be able to engage and ask these questions. So we really hope that this event will provide very valuable insights into what we are going to talk about and also encourage proactive steps towards combating hepatitis. So once again, I thank you all very much for being here, and we look forward to a very productive and enlightening session. So let's work together to turn the tide against viral hepatitis, moving from the current crisis to conquest. So right now, without further delay, let's take a few minutes to introduce our organizations and the work we do. So right now, I'll be calling on Mr. Darasimi. I don't know if he's here right now. Mr. Darasimi, are you around?
Yeah, I'm around. I'm around.
Okay, so we'll be having Mr. Darasimi, is a representative of Cytobis Medical Limited, to tell us what his organization does and why they are here. So thank you very much, Mr. Darasimi. You have the floor.
All right. Good evening, everyone. Please, can you hear me?
Yes, we can hear you. Good
Good
evening.
evening, and we can hear you.
Yes, I'll be handing over to Sister Folukemi. Are you here? Sister Folukemi.
Good evening, everyone.
Good evening.
Sister Folukemi, are you here?
Yeah. Good evening, everyone.
Good evening, ma.
Good
Good
evening,
evening.
good evening, ma.
Yeah, I welcome everybody to the webinar. My name is Ogunleye Oluwatoyin. I'm a member and a representative of Cytobiz Global Health Research and Training of the CEO and founder of Alliance for Global Infectious Disease in the name of Sir Rami Abdurrahim. I also am in the presence of CEO and founder of Cytobiz Limited in the person of Jimoh Abibulai. A brief introduction about Cytobiz Limited. Cytobiz Limited is a dynamic and diversified healthcare company and organization that strives to make an impact across various aspects of the medical industry by meaningful impact. I mean that Cytobiz Limited aims to positive change, bring about positive change, improvements and innovation in healthcare, ultimately enhancing the lives of individuals and communities. Are you with me?
Yes, we are
Yes,
with
we
you.
can
Yes,
hear
we are
you.
well with you.
So talking about global health research and training services, it serves as a subsidiary of Cytobiz Limited with a dynamic team led by Darasimi, a rapidly expanding health institute dedicated to transforming the healthcare landscape. Our primary objective is in three folds: advancing medical research, driving innovation, and addressing global health. As a Health Institute, we focus on health education, empowering individuals, communities, and healthcare professionals with accurate information, skills, and resources to make informed decisions and take action toward better health. Through our work, we aim to bridge the gap between research, innovation, and practical applications, ultimately changing the narrative of healthcare and creating a healthier future for all. Now, talking about advancing medical research, we strive to push the boundaries of medical knowledge, exploring new frontiers in health sciences, and uncovering innovative solutions to complex health problems. Talking about driving innovation, we foster a culture of creativity and collaboration. We aim to develop cutting-edge technologies, products, and services that improve healthcare outcomes and enhance the quality of life. Now, addressing global health challenges. Our mission is to tackle pressing health issues affecting communities worldwide, such as infectious diseases, non-communicable diseases, and mental health concerns through evidence-based research, education, and advocacy. Thank you for listening. We hope you learn one or two things during the webinar, and we implore your kindness. And I'm handing over to the moderator, Mr. Akinyemi. You can.
Thank you very much, madam. So that is our partner on this program, Cytobiz Medical Limited. So thank you very much for all of your work and all you have done in making this possible. So right now, I will be having my sister here, Auntie Sidiko. Please, Sidiko, are you here? Sidiko, Alaja Sidiko, are you around? If she's not here, our chairman and convener, Mr. Abdurrahim, would you please do us the honor of telling us a bit about Alliance for Global Infectious Diseases and what we do? Afa Abdurrahim, are you with us? Alpha Abdurrahim, if you can hear me, can you please signify? Okay, I think he's having issues with his own network and hearing us too. So, Agnes, are you with us? Agnes. Okay, if all of these people are not here, then permit me to do that right now. So my name is Akinyemi Bright once again, and
Can you hear me?
okay, Alpha Abdurrahim, you are with us now.
Yeah, I'm with you guys. Good evening, everyone.
Okay, thank you very much, sir. So let's have you give us a brief introduction about Alliance for Global Infectious Diseases and what we do and stand for.
Yeah, well, thank you very much, everyone, for joining this meeting. We appreciate you all. We at Alliance for Global Infectious Diseases, we embrace individuals who have been afflicted with public health diseases with open arms, offering not just information but a lifeline. We stand to educate and through our initiatives found a community of individuals who understand their struggles, stand by one another, and share stories of resilience and hope. We as members of AGID, we are working tirelessly to increase awareness, educate, and correct misinformation about public health diseases, ensuring that everyone have access to accurate and helpful information. We are building strong partnerships as well as collaboration with healthcare providers and local organizations, advocating for comprehensive health policies that will ensure that everyone have access to the care that they needed. We are launching initiatives aimed at reducing stigma and discrimination against individuals living with infectious diseases, educating and inspiring others. We aim to provide support, empowerment resources, and access to healthcare services for individuals affected by public health diseases, ensuring that no one faces their health challenges alone. As we gather here today to observe World Hepatitis Day, let's remember that we all are susceptible to these diseases and that one of the easiest and most attainable way to combat them is by staying informed and sensitized, as well as actively practicing health-wise behaviors, which the aged community provides. In order to break barriers and reach milestones, we as a community need to support one another in times of need. AGID needs your support. Alliance for Global Infectious Diseases needs your support to continue our vital work. As we all know, this is an organization founded by a group of higher institution students, whereby we come together and our work, as well as our mission, is that we want to work together to transcend borders and bring life-saving interventions to the most vulnerable communities through partnerships, through partnership with healthcare providers and other organizations. We will ensure our efforts are both sustainable and culturally sensitive. Together, we can fight misinformation, reduce stigma, and ensure that no one faces health crisis alone. Join us today. We are urging all our audience to join us, to join Alliance for Global Infectious Disease today, because together we are stronger. Together we can change lives. Thank you, everyone, and thank you for joining this meeting.
Thank you very much, Alpha Abdurrahim. So right now we will be going into the matter that has brought us here today, and right now we'll be taking in our speaker for today, Mr. Ebenezer O. Odewale. Mr. Ebenezer, you are welcome, sir.
Good evening, sir. Thank you very much for inviting me here.
Thank you very much for
I'm
coming, sir. We
glad.
really appreciate you, sir.
I'm glad it's an opportunity. I'm glad being here. Thank you very much.
Yes, sir. So, once again, we are honored to have Mr. Ebenezer as our esteemed speaker today. So, Mr. Ebenezer Odewale is currently the Chief Medical Laboratory Scientist as the Human Virology and Genomics Laboratory, now Center for Human Virology and Genomics at the Nigerian Institute of Medical Research, Yaba, Lagos. Yeah. So currently, he's actively involved in the RBL project NeuroCam, and he has extensive experience in coordinating laboratory operations. He specializes in microbiological examination for parasitic and bacteriological diagnosis, serological testing for HIV, hepatitis, and syphilis, and viral load estimation using advanced platforms like the Cobas 600 and A600. Prior to his current role as the Chief Medical Laboratory Scientist, he has served as the Assistant Chief Medical Laboratory Scientist from January 2019 to December 2022, and as the Principal Medical Laboratory Scientist from January 2016 to December 2018. His responsibilities have included quality management, equipment maintenance, and teaching students on industrial attachment. He is also an internal auditor for ISO 15189 and quality management systems, ensuring high standards in laboratory practices. Mr. Odewale holds a Master of Science in Clinical Chemistry and Molecular Diagnosis from the University of Lagos and is a fellow of the Medical Laboratory Science Council of Nigeria. He has also trained and presented at numerous national and international conferences, including workshops on HIV resistance testing and various scientific symposia. With a robust background in clinical chemistry, molecular diagnostics, and a commitment to advancing medical laboratory science, Mr. Odewale brings invaluable insights and expertise to our discussion of today on viral hepatitis. So we are privileged to have him with amidst us and share his knowledge with us. So thank you very much, Mr. Ebenezer. You have the floor now, sir.
Okay, thank you very much. And my sincere appreciation goes to the conveners of this great symposium, Alliance for Global Infectious Diseases and the Institute of Global Health and Research. As it is known globally, every 28th of July is World Hepatitis B Day. And the topic or the theme for this year's, is it's time for action. So the WHO, they are moving from policy to implementation for equitable treatment of people. And the topic we are observing this evening, from crisis to conquest, the decisive battle. So we're going to against viral hepatitis. These are the outline that will be observed in the course of our discussion this evening. And before we go into it, let me quickly say something about liver. Liver is one of the vital organs in the body, and it has so many functions that it performs that keep the body, going. And one of it is, it has synthetic functions, it has the excretive functions, and it has the metabolic function. Liver helps us to metabolize fat, protein, carbohydrate, and also excretion of bilirubin, cholesterol, hormones, and drug. Bioproduction and excretion is one of the things that liver also does in the body. Blood detoxification and purification is one of the functions that liver also performs to make sure that it clears our blood or our system of injurious things that can affect us. So in the course of carrying out these functions of the liver is prone to injury. And one good thing about liver is it has the regenerative capacity. Even if part of the liver is removed, maybe due to surgery, liver has the capacity to regenerate itself and grow back to the full size that it is. That is one of the things about liver. But having said that, if there is consistent injury to liver, it will go to a point that it will lead to liver damage, and it won't be able to carry out some of these functions that it does. And in that case, there will be problem with the whole body. So one of those things is, so in the course of the injury, there will be inflammation, which is the swelling of the liver. And when that thing happens, liver will not be able to perform its function efficiently and effectively. So that leads us to the topic we are observing today, viral hepatitis. But before we go into viral hepatitis, I want us to, first of all, examine the topic hepatitis. What is hepatitis? Hepatitis simply means an inflammation of the liver, which could impact on the normal functions of the liver, as I have said. And it is commonly as the result of viral infection, but there are some other possible causes of hepatitis. Majorly, viral infection are the cause of hepatitis, but we have some other factors that can lead to hepatitis. But let us know that the word hepatitis means the inflammations of the liver, which could impact on the normal functions of the liver. What are the other causes of hepatitis? Another one is autoimmune hepatitis. This autoimmune hepatitis means the body recognizes the liver cells as being strange or as being foreign to the body. So thereby, they now stand and work against the liver cell, destroying the liver cell. So that is autoimmune hepatitis. There is a book, a religious book says, a house that is divided against itself, it cannot stand. So when the body recognizes the liver cells as being foreign and starts to attack it, so that is autoimmune hepatitis, and it's very, very problematic. Another one is hepatitis that occurs as a result of medication. Some people, they misuse drug. They use drug indiscriminately. Some people, whenever they have headache or they are feeling pains, they will go for analgesic and be taking analgesic. And all these analgesic, they have adverse effects on the liver, because liver helps us to detoxify some of these drugs. After the drug might have, performed its duties, all the debris, it is the liver that will clear some of them so that the chemicals will not remain in the body and become injurious to some other organs. So, and we should not forget that some of these drugs that we take, they are chemicals. So they are injurious to liver cells that are called hepatocytes. Drugs, then toxin from microorganisms can also impact on the liver and cause problem. Another thing is alcoholic hepatitis. This one is as a result of consumption of alcohol. Consuming alcohol, it can have an adverse effect on the liver and cause liver problem, which is the inflammations of the liver. Another thing I quickly want to say here is where malaria is endemic, we have what we call malaria hepatitis. We know that malaria parasites, they harbor the red blood cells and also the liver cells. So if one is under the attack of malaria for so long, it can affect the hepatocyte and cause liver problem. And according to the studies, they said those who have malaria hepatitis, they tend to developing liver complication in the nearest future and can lead to death. Then what is now viral hepatitis? Viral hepatitis is the hepatitis that is inflammation of the liver as a result of the viral infection. And we have 5 major viruses that can affect or that can attack the liver. The first one is hepatitis A. This one causes acute or short-term infection. But the beautiful thing about hepatitis A infection or infection is that it can clear on its own. And hepatitis A is food and waterborne infection. We can contract this hepatitis A infection by eating or drinking a contaminated water. Then the second one is hepatitis B. This one is blood-borne and blood product hepatitis. It is transmitted sexually, and it can lead to chronic infection and diseases if not known on time and if the treatment is not put in place to put it into check. And the third one is hepatitis C. This hepatitis C also is blood product borne, and it is sexually transmitted. This one also can lead to chronic infection and diseases. The fourth one is hepatitis D. This one is a rare form of hepatitis that can occur in conjunction with a hepatitis B infection. One can contract hepatitis B only if one has been infected with hepatitis B before. So one cannot just have hepatitis D. It's like a co-infect individual with hepatitis B. The other one is hepatitis C, which is also the waterborne infection. And this one, when one is in an unhygienic condition, predisposes one to hepatitis E infection. Both D, E, and A, they can clear on their own, even without any intervention or without any medication. All those ones can clear on their own. Then the new one, I can't say it's new, but it's not a common type of hepatitis. They call it hepatitis G. And this one is also blood-borne hepatitis. But the research shows that hepatitis G is like, it has, the genome for hepatitis G, it has a link, a similarity to the genome of hepatitis B and hepatitis C. It could be maybe as a result of maybe a mutant strain from B or C that produces hepatitis G. Then hepatitis B and C are the major viruses that are responsible for some of the viral hepatitis disease. They lead to chronic disease in hundreds of millions of people in the world, as I have said earlier. And they are most common causes of liver cirrhosis, which is a form of cancer of the liver, and they lead to viral-related death. Then let us now look at the WHO 24 Global Hepatitis Report. And this is where we know that there is crisis. The number of lives lost due to viral hepatitis is increasing. Despite the fact that there is an intervention, it rises from 1.1 million in 2019 to 1.3 million in 2022. And it is the second leading causes of death globally, accounting for 1.3 million deaths per year.
Mi ò mọ̀ ìdí tára fi gbọ́. Listen.
So sorry, everyone. We'll be back shortly, please. We will be back shortly.
All right, because we can't hear you anymore.
Hello, can you hear me?
Yes, we can
Yeah.
hear you.
We can hear you now, sir.
There
Yes,
was
we
a
can.
disconnection. From where did it
All right,
go?
sir. All right, sir.
From where?
Yes, from Mother Queer advertising.
Slide
Please,
eight,
I
slide
said
number
one
eight.
up here.
Slide
Yeah, we are
number
talking
8.
about the global health report. Yeah.
Okay, okay, I'm sorry. So WHO Global Hepatitis Report, it was reported that the number of lives lost due to hepatitis B is increasing. Despite the fact that global WHO is assisting those countries with a great burden of infection, with testing and treatment. But we still discover that the number of lives lost due to viral hepatitis is increasing. It increased from 1.1 million in 2019 to 1.3 million in 2022. And it is the second leading cause of death globally. It accounts for 1.3 million deaths per year. And I said, between hepatitis B and hepatitis B contributes 8.3% of the viral hepatitis, while the 17% were due to hepatitis C. So every day, it was estimated that 3,000 people were dying globally due to hepatitis B and hepatitis C, infections. And there was a report that even per minute, I think 50 people are dying per second of this viral hepatitis worldwide. This is alarming, and it is a crisis. So an estimated 250 million people worldwide live with hepatitis B and 50 million with hepatitis C as at 2022. But the thing is that few people with hepatitis are being diagnosed and treated for most. Testing and treatment remain beyond reach. Only few out of those who are infected with hepatitis B and C are accessing treatment or are being diagnosed, because the cost of treating hepatitis B or C is even high. So, and some, the treatment is beyond their reach. In Africa, hepatitis is a silent epidemic. More than 90 million people are infected with the virus in Africa. So it is estimated that 20% of the global burden of viral hepatitis is from Africa. And if you pin it down to Nigeria now, Nigeria has a prevalence rate of 8.1% of hepatitis B, and 1.1% of hepatitis C among the adults of age 15 and 64. And if you look at this age range, these are the most promising age in one's life, from age 15 to 64. And if these ones are infected with virus, so it means there will be increase in morbidity and the mortality among this age range in Nigeria. And if you compare it with HIV, currently the prevalence of HIV in Nigeria is 2.2, because Nigeria had tackled the HIV infection headlong. If the kind of treatment we give to HIV, we can also give it to hepatitis B, I believe that we'll be able to bring down the prevalence of hepatitis B down maybe to near 2.2 or even lower than that. And another thing we need to know is that hepatitis B virus, they are more deadly than HIV virus. They are more deadly, because if the blood that has hepatitis B is on a table now, you can still be potent even after a week. But for HIV, within 30 minutes, 1 hour, the virus in that blood, they are dead. But for hepatitis B, they can still be potent. So we need to tackle this viral infection, that is hepatitis B and hepatitis C. The kind of treatment we give to viral to HIV hepatitis. A report estimates that 80% that have the virus, they are unknown. So if the prevalence that the global world is presenting and the one that we record in Nigeria, it means it is only 20% of those who are actually infected that are captured in the prevalence data that we give. So it means all hands must be on deck to make sure that we diagnose, or we test a lot of people in order to be able to prevent this infection or stop the spread of the infection further. Then how it spread? The first one is contaminated food and water for hepatitis A virus and hepatitis E virus that are waterborne. So if one ingests or drink water that have been contaminated, food that have been contaminated, or water that have been contaminated with this virus, there is possibility of contracting all these virus. Sharing of infected sharps through body, tattooing, nail cutting vendors. It is amazing, or it is surprising at times when I go in the street and I see people, giving their hands, their legs to all these nail cutting, vendors that use the same kind of, scissors or the scalpel that they use for so many people, even without sterilizing it. So one can contract hepatitis B, hepatitis C, or D by sharing all those things. Then by putting tattoo. Tattooing is the order of the day now. If you don't have tattoo on you, you are not a big boy, you are not a big girl. So tattooing is another way where one can contract. Then sharing of needles by the addict for parenteral drug injection. Those drug addicts, they wouldn't mind. They would think maybe they love themselves. They can share the same needle to inject themselves with the same drug. Maybe they are high. Just give me that injection. Let me also. So by sharing that kind of thing, sharps, one can contract hepatitis. Those who are blood-borne hepatitis. Then transmission of infected blood and blood products. Some people are being infected during transfusion because they were transfused with infected blood and the blood product. Then also it could be passed from mother to child transmission during childbirth. So it could be passed to mother and to the child if the mother is infected and it's not on medication or precaution are not taken during childbirth. The child could be infected with the virus. Then what are the symptoms of hepatitis? One of it is fatigue. One will feel tired. Then unexplained weight loss. One will be losing weight and you are eating well, you are feeding well, but still you are losing weight. Then if there is abdominal pain, certain part of the body, the abdomen is paining one, you feel sharp pain in your abdomen, or loss of appetite, you don't feel like eating, they give you food. Even your best food is presented to you, you don't feel like eating it. Or when you pass your stool and you make sure and you see that your stool is pale, then it is one of the symptoms. Then when you have a dark urine is very, very dark, like brownish dark color, is a sign, is one of the symptoms of hepatitis. Then flu-like symptoms. You have catarrh that refuses to go, or you keep sneezing and coughing and all those stuff. So they are one of the symptoms. Then what are the complications of viral hepatitis? If one is infected with viral hepatitis and there is no intervention, so it can lead to liver cirrhosis. Liver cirrhosis is a kind of liver cancer. Then some other complications that lead to the following complications. There could be bleeding disorders. Liver produces one of these coagulation factors that help the blood to be in the form it should be. It will not coagulate, it will not clot. It will not clot in the body. So liver produces some of the coagulation factors that helps to maintain the blood in the form that it should be in the body. Then build-up of fluid in the abdomen. There will be fluid in the abdomen called ascites. Then there is portal hypertension. Then it could lead to kidney failure. Then also it can lead to hepatocellular carcinoma, which is a form of liver cancer. Liver cirrhosis is like a scar in the body. It's not liver cancer. It's a scar in the body. And if there is a scar, that particular that is scarred will not be able to perform its function very well. So liver cancer is called hepatocellular carcinoma. And ultimately, if it is not taken care of, it can lead to death. Then, how is hepatitis diagnosed? Then we have the rapid kit diagnosis, which is a qualitative diagnosis. It will show whether it is positive or it is negative, and it is available everywhere. If you go to market, you say you want to buy hepatitis kit, you can buy it, and you can even do it in your home, in the comfort of your room. Or if they can help you to collect your blood, then you can dip it there. You allow the blood to settle, or you can use the whole blood, or you can use the plasma or the serum, as the case may be. So we have the rapid kit that will give the result within 3 to 5 minutes. Then we have the serology by ELISA. You know, in case there are some people, they use rapid kits, maybe they are not comfortable with it, they can come for serology by ELISA. That one is also qualitative, but it's more advanced than the rapid diagnosis. So it will give whether it is positive or is negative. The other one is molecular diagnosis. This molecular diagnosis is for quantitative. You know, if one is infected with virus, with hepatitis B or viral, hepatitis, you need to know the quantity in the body to know the kind of intervention to give. Some people believe, some school of thought believe that if you have viral, let's say for example, hepatitis B viral load, international unit that is less than 1,000, that what you need to do is to take good care of yourself, eat good food, that the body will be able to cope and manage the virus, and it will not lead to liver cirrhosis or liver cancer. Then another one method we can use is liver biopsies. This biopsies is a situation whereby a part of the liver, is taken, and will be taken for histological examination to see the effect of the virus or what the hepatitis had actually done to the liver. Then we have liver function tests. We have different liver function tests. We have AST, aspartate aminotransferase. We have ALT, alanine aminotransferase, and we have albumin. We have total protein. We have the total bilirubin. We have the conjugated bilirubin to test the conjugated, powers of the liver to be able to excrete some of these bilirubin. Accumulation of bilirubin in the body is very injurious to our health. So the liver helps to remove them from the body. So we use liver function tests to check whether the liver is functioning well or not. But the thing about liver function tests is that before it shows, aberration in liver function tests, 75% of the liver might have been damaged. Then another one we can use for diagnosis is ultrasound. Can go to ultrasound, so they'll be able to scan and see the liver real life. They will see the surrounding tissue, what could have caused the problem with the liver. Then in serology by ELISA, we have some panels that could be done. We have hepatitis E antigen, we have hepatitis E antibody, and we have hepatitis E core IgM, core antibodies. That one will show whether one has contracted the virus in the past 16 months. If core IgM is positive, it means the person had just contracted it within the last 6 months. But if it is negative, it means the body contracted the virus more than 6 months. And E antigen and E antibody, you try to interpret it with molecular diagnosis. If you have a very high molecular diagnosis and hepatitis E antigen is negative, possibly the person has a mutant strain. And that mutant strain, they are the ones that are difficult to treat, and it can lead to liver, cirrhosis, scarring liver, or hepatocellular carcinoma, which is the cancer of the liver. Well, about the treatment, hepatitis B virus, though is a DNA virus, but the mode of replication, it replicates through reverse transcriptase. So they use some of the drug that they use for HIV to manage, hepatitis B virus. But you don't go and buy drugs. Before you go for treatment, you have to go and see medical doctors, special medical doctors. They call them gastroenterologists. They are specialized in managing all these internal organs, diseases. So anybody who wants treatment should go and see them. They will be able to give you, the best treatment you could ever get. Then the context. Whose responsibility? If we are to, to conquer this surge, this hepatitis B viral and this hepatitis viral hepatitis infection, it is the responsibility of each and every one of us. All hands must be on deck. In fact, WHO said by the year 2030, they want to eradicate or to reduce the prevalence of viral hepatitis to the barest minimum. And we are in 2024. And the report that they gave shows that we are not near, the target or the goal of WHO. Then how can it be prevented? Never share sharps with anybody. Make sure that you get your clipper. Make sure that your nail cutter, do not share it even with the members of your family. Nail cutter is not that expensive. We can go and get it in the market. Each member of the family must have his own nail cutter. That you are members of the same family does not mean you should share the nail cutter or the clipper. Then everybody should try and know his or her status. And if negative, go for vaccination. Every one of us, we must know our status. And make sure that every members of your family know his or her status. Let them go for hepatitis B screening. And anyone that is negative should go for vaccination. At present, there is no vaccine for hepatitis B, hepatitis C, and hepatitis E. But hepatitis A, hepatitis B, they have vaccine. The research shows that what can work for hepatitis B can actually, the vaccine that can prevent against hepatitis B, can actually work with hepatitis D because they co-infect. Then immunization from birth. In this part of the world, we don't give vaccine or immunization to our babies, not until after 6 weeks. But in the developed world, within 24 hours of birth, they give immunizations to their children in order to prevent them against, this surge. Then we need to create more awareness, improve detection and treatment. Then we should avoid or reduce alcohol consumption. We should take it to the people at garages that they should avoid or stop or reduce consumption of alcohol because we have alcoholic hepatitis, which is very delicate and dangerous for their health. Then drug usage without doctor's prescription should be discouraged. Before you take any drug, even over-the-counter drug like paracetamol, you shouldn't, misuse them. Anytime you feel headache or anytime we have pain in our body, we go for analgesic. No, it's not like that. At times you need to give yourself rest. If you eat well and you rest well, you will see that all those pain will go away. Then proper monitoring of blood transfusion should be enhanced. Government needs to intensify their monitoring of our blood banks. They should audit the blood bank to make sure that the blood that they dish out to people, they give to the patients are safe and are free of viral hepatitis and some other infectious diseases. Then practicing effective hygiene can help to prevent hepatitis A and hepatitis E. We must make sure that our environment is clean. We must live in a clean environment. Then another one is viral hepatitis should be mainstreamed into health insurance. It is sad that viral hepatitis treatment is not part of National Health Insurance Scheme. It should be mainstreamed into it so that those who have the infection will be able to access treatment unhindered. Then the treatment should be free, like the HIV. As I've said, HIV treatment is more or less free. So hepatitis, other viral infection like hepatitis B and C also should be made free. We should desist from wearing fairly used clothes. We know that the economic condition of Nigeria is not too good. But that one does not mean that we should go to Yaba, right, and buy fairly used clothes. We should tell people, if it is one cloth that we can afford, make sure that you buy new clothes or you sew new clothes. Don't go and buy fairly use clothes, because through it we can contract viral hepatitis. Then WHO eradication program. WHO global hepatitis strategy aims to reduce new hepatitis infection by 90%. That is what World Health Organization wants to do, and they are trying. They make sure that the treatment is within the reach of the country where viral hepatitis is endemic. And they want to reduce the death by 65% between 2016 and 2030. And they are working towards that. And they have the recommendation and precognition of self-tests for hepatitis C. There are some tests now that you can do in the comfort of your home for hepatitis C infection. It has been pre-qualified by WHO, and they recommend that individual can go and purchase and do self-testing. Then we should support for the endemic countries in the development of policy and guidelines for viral hepatitis eradication. WHO is doing that. They are helping those countries that are endemic with viral hepatitis to develop policies and guidelines so that they will be able to eradicate this viral hepatitis. There was a time at NIMA that we had a collaboration with a company, and they subsidize, testing for viral hepatitis quantification. So we were doing it 12,000, but when they withdrew their support now, we have no choice than to make sure that we jack up the price, but it is still, reasonable compared to other, laboratory outside where hepatitis B is being done. And our research scientists in NIMA, they have developed internally developed test kits for viral hepatitis B quantification, and that one has helped a lot, and it has been factored into the cost of viral hepatitis in NIMA. Then reduction in the treatment cost by the WHO. WHO is doing that to make sure that the cost for treating viral hepatitis, is within the reach of those who are infected with the virus. In conclusion, eradication or reduction of morbidity and mortality due to viral hepatitis as proposed by the WHO is achievable within the little period left to 2030. We have 6 years to 2030, but we can still achieve the WHO goal of eradicating or reducing the morbidity and mortality due to viral hepatitis if all of us can brace up and wage war against the surge in our world. Another thing is that we can strengthen the primary health care that we have in Nigeria. We can increase their capacity to be able to test or to diagnose, and even the treatment, so that we'll be able to take the treatment to the grassroots. Thank you very much for listening. I rest my case here.
Please, thank you very much, Mr. Ebenezer. We really appreciate your efforts. So right now, because of our time, we will be taking questions. We have entered the question and answer session now. I said earlier that everyone should start noting down their questions while the lecture is going on. So yeah, at this moment, we will take questions. So if you have a question, please, can you come up with it right now? If you have a question, please unmute yourself and ask right now.
Good evening.
Good evening.
Good evening.
I'm sorry. When I was diagnosed, the viral load was 11. They wrote 11 there, but I'm a nursing mother. And when I went back to my antenatal place, a dog was not prescribed to me.
Okay. Well, is that okay? Thank you very much for the question. in the course of the lecture, I told you that if you have a viral load that is less than 1,000 international units per mil, the doctor might not give you medication. Some will say they won't give you medication because the body on its own can help to manage the virus. If you eat good food and you live well, your body can cope with that viral load of 11 international units per mil. So you don't actually need, drug. What you need to do is to eat well, don't take alcohol, make sure you rest well, and your body. But at that, every 6 months, you should always go and check your hepatitis B viral load. But if it is now skyrocket, you quickly go and meet your doctor. It means maybe your body immune system is not able to cope with the virus well. But with 11 international units per mil, the doctor is good by not prescribing any drug or any medication to you. So nothing is wrong with you. It is okay. Just make sure that you keep on eating good food, eat well, and keep proper hygiene, and you are good.
Okay, sir. Another question is, can it be cured? Hepatitis B. Can it be cured? Or because when I met with the doctor, he said if my if my immune system is strong enough, it can fight it on its own and it can eradicate it. I don't know how true is that, sir.
Yes, from the report says those who are infected maybe in the childhood, before they grow, they can actually, clear the hepatitis B. While those who are infected at the adult stage, it can lead to chronic hepatitis. It might be difficult for it to be cleared. But some other report says hepatitis B viral infection cannot be cured, but it can be managed. But the most important thing, because is for it to be managed, not to progress into scarring liver, which is liver cirrhosis, or to hepatocellular carcinoma, which is the cancer of the liver, that liver will not be able to perform his role. I've known somebody, he has been infected with viral hepatitis for 30 years now, and he's not on any medication, and if you see him, he's still good. So don't bother your head much about whether it could be cured or it could be, but the most important thing is it could be managed, and make sure that you go for monitoring from time to time to check your body. And if you don't have any of the symptoms, you are good.
Okay, sir. Another question is, sir, what are the kind of foods that as an hepatitis B or C carrier, what are the type of foods that we can avoid, and what are the type of fruits that we can take?
Well, the kind of food you can afford, all these fried food, you should run away from them. Then the red meat, you should run away. Then the fatty food, fat, you should run away from fat. So those are the things. And then the fruits, usually you can eat all these good fruits. You can eat watermelon, is there, apple, pineapple, and any good fruits. You can take them. They are good for you.
Okay, sir. Thank you, sir. That's all my questions, sir.
Okay, thank you.
Thank you very much, sir. So we will take other questions right now. So please, if you have a question, please shoot right now. Any questions, please?
Hello.
Good evening. I don't know songs.
Yes, good evening, ma.
Okay, please, I would like to ask if hepatitis is hereditary. Thank you.
Okay. Hepatitis is not hereditary. As I've told you, it's an infectious disease. Sure, you understand? It's not hereditary. You cannot pass it to your children. The only way it could be passed to a child is during childbirth. If the mother is infected and during the birth of the baby there is contamination, there could be an infection. That's the only when it could be passed to a child. But it's not hereditary. It's not hereditary at all. You can only be infected, maybe through all those means or routes.
Sir, what about when someone wants to give birth during the childbirth? When I wanted to give birth, I was asked to get this anti-hemoglobin injection for my child, and I was told not to give him. I was told not to breastfeed him until the injection was given to him. Before within 24 hours, within 12 hours after birth.
Yes, those are the kind of precautions that doctors, took when you wanted to deliver. And that is good. Like I said, in the Western world, in the United States of America, if a child is born within 24 hours, they will make sure that they vaccinate the child. But in Nigeria, I think it's after 6 weeks or thereabouts, or I'm not sure that you can access, vaccination or give your child a vaccine. But in the Western world, that is what WHO is now recommending now, that in the countries where there is endemic, where viral hepatitis is endemic, that they should start all these monovalent, vaccination 24 hours after the child is born.
So what I'm asking is my child safe? Because the injection was given to him.
And you say, if it's not safe, the doctors, they know what they're doing. Your child is safe. And they told you not to breastfeed him until they gave him that. Your child is safe.
Okay, sir.
Thank you very much, sir. So do we have any other questions, please?
Hello.
Hello, sir.
Yes, sir. You're welcome, sir.
Okay, good. I don't have a question, but I just want to commend the presenter. Mr. Dewale and I works in the same institute, Nigerian Institute of Medical Research in Yaba.
Yes, my God. Thank you, sir.
I listened carefully to the presentation. It was an excellent one. It's a world-class presentation, and I think the participants or attendees at this meeting will take note of everything that he has said. But I want to throw some challenges to the attendees, because I have noted clearly that a greater percentage of the attendees are youth. And the youth have a lot of things to do in terms of reducing the burden of infectious diseases. Alcoholism is on the increase among the youth. You see people riding Okada with alcohol. Even there was a time NAFDAC banned it, and they even prohibited the importation of the suspect alcohol. There was a revolt against it. Up to now, NAFDAC is to enforce compliance. I don't work for NAFDAC, but I believe that policy is a way of safeguarding our youth that are prone to many infectious diseases, especially this hepatitis as a result of alcoholism. We also need to play a significant role in biosafety, biosecurity, especially the biosafety aspect. We should avoid the indiscriminate use of staph aureus, like you have said. So we need to take everything that I have said in this presentation more seriously, because we have had enough of all this talking. What we need to do now is implement lessons learned from all of the presentations. I quite agree clearly with Mr. Ebenezer concerning the practice in the developed world. I just had a grandchild last month. She's just a month today. And before the child was described, they were given a kind of fascination. They first one was on the left side, the second one was on the right side. And my daughter sent the video to me, and I was asking my daughter, what type of vaccination is this that you are giving to the baby that was just born today? And he told me one was hepatitis, the other one was another vaccine. So right there and then, they are complying with all of these WHO specifications. So in Nigeria, our youth should also be advocacy of implementation of all of these WHO policies and some other national policies that are aimed at controlling infections in our country. These are some of the things I want to contribute. And I want to commend Mr. Odewale again and all the attendees for the rapt attention. Thank you for doing us right, Mr.
Thank you very much, sir.
Thank you very much, sir, for your very wonderful insights. So please, we continue with the question and answer session now. So if you have a question, please go ahead. Anyone with a question?
Okay, my question
Anything you have
again
from
is
the
that
session?
for hepatitis case that has worsened to like cancer of the liver or the cirrhosis, is there still hope for such patients? Like, can it still reverse the case, or is always going to lead to death?
Well, sometimes ago, a friend of mine, brought some results to me, and I took it to one of my doctor's friends. I think he's a gastroenterologist. So when he saw the results, and the result was very bad. So, and I told him, what can we do about this one? Well, what he told me, being a doctor, is that at that level, there is more to nothing they can do except if there is a transplant. They can go and get another liver, maybe to transplant another liver to the person. But that particular liver has, liver has 75% functional reserve capacity, meaning not until 75% of liver is damaged, liver can still, that 25% can still work. That's why I said liver can regenerate. But I think beyond that level, there might not be solution apart from liver transplant to remove the whole liver and bring another liver. If we are in the Western world now, I know that there is cloning. Maybe before you get to that level, they might have taken that an hepatocyte from that original liver, then go take it to the laboratory, grow it to a huge or a normal liver. Then they will now transplant it into the patient. With that, there won't be host to graft reaction. But if you bring another liver from outside, after that one has been damaged beyond repair, then there could be host to graft reaction that can even damage the liver that has been grafted into the patient. So don't let me say there is no hope. There is hope. There could be a liver transplant. And if the person is rich enough, they can go to the Western world or seek some medical. Let the person see gastroenterologist. They will know what to do because it is beyond the scope of my profession. So, and I don't want to say what. Well, let me beckon on my Oga Alhaji T.Y. Rahim to help me with that answer, sir. Hello, sir.
Oh, yeah. Thank you very much, Mr. Odewale.
Yes, sir.
I think your response is perfect.
Okay.
And there is no shortcut to that. So it is better to, even if you want to do transplant, it is not something that is feasible here in Nigeria. So what you have said is perfectly in order. Thank you.
Okay, thank you, sir.
Thank you very much, sir, and thank you all for all of your questions. So, any other question, please? Okay, if there is none, I will ask my own question, sir.
Okay.
So, sir, you mentioned earlier that there are vaccines now, I think for hepatitis A and B,
Yes.
despite the presence and the significance of these vaccines, there is still like a very high number of patients that are still unvaccinated. So, what
Yes.
do you think are the main barriers to vaccination, and how do you think these barriers can be overcome?
Well, the barrier to vaccination, like some people don't know where they can get the vaccine. Some people don't know that there is vaccine. So I think there is need for us to have an awareness to tell people that they could be vaccinated. The first thing is to get tested once they are negative. And it is alarming. Some people that are even infected, they say they want to get vaccine. Anybody who is infected with the virus does not need vaccine. What the person needs is treatment. The vaccine is for those who are negative to the virus. So some people don't know that there is vaccine and they don't know where they can get it. And what we need to do is, like I've said earlier, the primary health centers, there should be vaccine. The government should do it in such a way that the vaccine will be at the primary health centers. The cost for treating viral hepatitis is very expensive, but prevention is better than cure. We should let the government know that they can prevent it. It is preventable. So if we prevent it and people are not infected, they won't spend money on treatment or to cure it. So I think we need advocacy on that. Primary health centers, there should be vaccination at primary health centers that is very close to majority of people. So we need to let the people know and where they can get the vaccine. Well, the good news that I want to give is in NIMA, we have vaccine for as many that want to get vaccine. With a token of 15,000 naira, they can get vaccinated. And you could be vaccinated for life. Then another thing is the potency of vaccination. After we might have been vaccinated, we need to do a test that is called hepatitis B surface antibodies. That is what will now show whether the vaccine you have taken is potent or not. There's one thing for you to be vaccinated. If you are vaccinated with the vaccine that is not potent, you might still not be fortified. But for you to be sure, after you have been vaccinated, you need to go for hepatitis B surface antibody test to know whether you have been protected for all this infection or not.
Thank you very much, sir. Still on the issue of vaccines, sir. So let's say, for example, I get vaccinated once against let's say hepatitis B now. Is it one in a lifetime thing, or is it something I have to always come back, maybe periodically, maybe after 10 years or something, I need to come back and get the vaccine again? Or is it just I get it once, I have lifetime immunity to it?
We have different school of thought. Some believe that once you are vaccinated for life, especially for hepatitis B, but you can get booster. So there is a test you will do to check the level of immunity you have to it. You are going to do quantitations of that surface antibodies. One thing, hepatitis B surface antibody, if it is positive, it shows that you have been vaccinated. Though you have the antibodies against the virus, but what is the quantity? So you have to go and do quantitative test for hepatitis B surface antibodies to know whether you need booster or not. After 10 years, when you do it and you see that the level of immunity has gone down, you need to go and reinforce to get booster.
Okay, thank you, sir. The last one, this is more like a request and not really a question. Because right now, and I was in a gathering recently, and someone was saying this person is an healthcare provider too. Is a staff as NIMA too. So, and he said something like they were out for a particular outreach, and when everyone has talked, okay, people have talked about HIV, they talked about tuberculosis and malaria and all other infectious diseases. Then it goes to the part of hepatitis, which was his own part to take. And he told the people that, okay, if you know what hepatitis is here, please raise up your hand. And it actually turned out that most or even all of the people that were at that particular outreach did not know what viral hepatitis is. and they think, well, it's still a disease that is still very far from us. It is something of the white. So the awareness about hepatitis is still at the grassroots. So what do you think is responsible for this, and how do you think we can get rid of this and get this knowledge across to people, just like we are for HIV/AIDS right now?
Thank you very much for that question. I think, when we are talking about the conquest, whose responsibility is everyone's responsibilities. The religious leaders, we need to carry them along. It will be good at our religious centers. Today is Sunday. Today is the World Hepatitis Day. At my church, there was no mention of hepatitis at all. I think the kind of message that should come out today should be health talk message. So that the people in their churches, at mosque, we should discuss the viral hepatitis. Today being viral hepatitis day. So even the kings, all these obas, we should go to the community and take it to them and tell them what hepatitis is, so that there will be awareness. So that's what we need to do. We need to carry other people along, especially the religious leaders and the royal fathers or the community leaders. So we need to carry them along. We need to tell them in a clear term what these infections, what they are and what they can do to the body, and they are preventable, and what we can do to curtail or to prevent them. So the religious leaders, the community leaders, and all the people there should be carried along if we actually want to reduce the death to viral hepatitis by the year 2030, according to WHO.
Excuse me,
Okay,
sir.
thank you very much.
Excuse me, sir. Sir, please,
Good
can a
afternoon.
child?
You said?
Good afternoon, sir.
Good afternoon.
I said that I'm a married couple, and their child also contacts the hepatitis B, or is it only for adults?
It's not only for adults. It's not only for adults. A child can. That's why I said in the course of presentation, there could be transmission during childbirth. So if a child can be infected with hepatitis B or with viral hepatitis, any viral hepatitis, is not for adults alone.
Because there is a recent case of hepatitis B where the husband later died, but the wife survived. Is there any chance that the children might have the hepatitis B virus?
Is it?
Is there any any chance, any possibility that the children will also have the virus?
The children will always have it. Will always also have it.
Yes.
If they are infected in a way, let's say for example now, they go to barbing salon, God forbid, and they use contaminated barbing clipper on them. They could contract it. If they share, let's say, the nail cutter that has been contaminated, they could have it. There is possibility. Anybody could be infected.
Sir, the wife now that she has and she has survived, does that mean that she cannot have it again? That she's free completely from it?
The child, you said?
No, the wife also contacted the virus, but
Okay.
now she's fine.
But now
Free from
she's fine now.
Yes, sir.
Yeah, it's okay. So what's the question?
But the husband, no,
okay,
I'm saying that
the husband is negative,
yes.
Abi?
No, the husband is also positive, but he died.
Okay.
Yes.
Oh, so sorry. Okay, but
Yeah.
the wife is okay. I mean, is that what you meant? And that is okay.
Yes.
Well, what the wife should do is to go and meet gastroenterologists. Let them do the viral load. They quantify the virus in the body, whether she needs medication or not.
Sir, the wife, she's positive. They have treated her. Now fine.
and that is fine. It's not a one way or one time thing. He has to continue to monitor himself every 6 months. You should go and check the viral load, hepatitis B viral load, to know the virus, the quantity of the virus in the body, whether the body is coping well with the virus or not. Don't just assume that once treated is treated forever. No, he has to be monitored. Once in a while, he could be doing his liver function test. Then he could go for hepatitis B viral load. Hello?
So I think Barakas has technical issues. So thank you very much, Mr. Ebenezer. We really appreciate you.
Thank you.
Thank you very much, sir. And also thank you to everyone that has listened and has stayed to the end of the program. So right now I will be calling on our convener, Mr. Rahim Abdurrahim, to give us the vote of thanks.
Good evening, everyone. Good evening, sir. Mr. Dewale Ebenezer.
Good evening to you, bro.
Firstly, I would like to appreciate the Almighty God, and then I would really appreciate you for joining us in this meeting. You accepted us the way we are. You see us that we are students, and you actually give us the audience. I know that you are very busy. I know that as we speak, you are actually at work. I know that you still work late till yesterday, which is actually Saturday. But still, you still join us here today. We are really, really grateful. Thank you very much for benefiting us with your knowledge. Also, I was surprised when I was looking at the registration form and I saw that our father, the head of department of molecular biology and biotechnology in NIMA, registered for the event. When I saw the mail that he registered, I saw that he's not on the WhatsApp group. So we have to send him a special invite on his mail, send the Google Meet link to him. Dr. Rahim, we actually appreciate you for joining us. We are really, really grateful for this great opportunity.
Thank you very
also,
much.
I would like to plead to you. When Mr. Ebenezer was talking, when he was answering questions on the reason why we don't have much of awareness and all, I said to myself, this is what we stand for at AGID. We are here to bridge the gap between the government and the people. We want everyone to have access to quality healthcare facility, to get tested as early as possible. And I don't know, but I'm pleading to our father, Mr. Ebenezer, as well as Dr. Rahim, if we can actually get your backing, we will like work with you, even if you just have to give us, there's a saying that having a qualification from higher institution is not as effective as going through a door and say it is from me. When you give us the access of, tell them you are from me. It's me, Dr. Rahim, that say you should come. We have opportunity to get benefit from where we are going. We are ready at AGID to work with you, sir, so that we can bridge gap and see how we can also come in as an organization so that many people will be well informed. Although currently, as it is, we're writing letters to various organizations. Just this week, we went to NASFAT headquarters, submitted letters to them requesting them to give us access so that we can come there and educate people on HIV actually, not hepatitis. we've not been responded to. Maybe that's because we are students, when you are not big, people don't really want to support you. But when they see that, oh, this person is on the high side now, people tends to support him. Now it's not a support, it's just more like people are funding. So we will really be glad if you can give us that access to you so that you can give us some guidance that will be off camera so that we can have access to certain places and what we can do better. My team and I will come to you if you give us the permission to come, sir. That is my pleading. Also, I would like to appreciate Mr. Abib Saitobis for the opportunity of collaborating with him. He has been doing this for long, but this is our own first online webinar. We have been posting on social media, doing series of that. We've not actually hosted this online webinar. So I'm really, really grateful to him for his advice, which we incorporated and we're actually seeing the results. Also, we are appreciating him for the collaboration, not looking at us because many big organizations will not want to collaborate with small organizations. They'll feel like, what are we going to benefit from you? But to Mr. Abib of Cytobis, that's not the case. He embraced us as brother and we actually work together. We thank the Almighty Allah for giving us this opportunity to succeed on this. Also, I would like to appreciate everyone that joined from our various institutions, from Kwara Poly, FASU, from University of Ilorin, from University of Medical Sciences, from various institutions, from Unilag, from Caleb, from Covenant University. I can see you all, and I'm actually very grateful to have you all here. Also, I would like to appreciate my team at AGIB. All of you, we really appreciate you. We are very grateful. And I believe that by all of us supporting ourselves together, we definitely, and by God's grace, achieve more and better opportunities. Bismillah. Thank you, everyone, and thank you for coming.
Thank you very much, Alpha Ibrahim. And right now, I'm receiving the message from my father, Dr. Toyosi Rahim, that our request has been expressly granted. So thank you very much, sir. We really appreciate you, sir. So we will reach out to you, sir.
Thank you very much, sir. We definitely come to you, sir.
No problem. Thanks a lot for the opportunity to serve.
Thank you, sir. So ladies and gentlemen, we have come to the end of this very insightful webinar. Once again, I want to extend my deepest gratitude to everyone that has made these events possible. Our partners, like Toby's Medical Limited, our speaker, Mr. Ebenezer Odewale, and to our father who has graced us in this program, Dr. Toyosi Rahim. So we thank you very much, sir. Today, we have explored the challenges and advancements in the fight against viral hepatitis. And we really hope that this session has provided you with a deep understanding of the importance of education, prevention, and treatment in tackling this health issue. So it is crucial that we all continue to raise awareness and advocate for better access to healthcare, to vaccinations, and to treatment. Together, we can combat the stigma associated with hepatitis and encourage more people to get tested and seek treatment early. So I want to implore us as we live here today, we carry forward the knowledge and insight that we have gained, and we take proactive steps within our communities to spread awareness and support those that have been affected by hepatitis. So each of us has a very big role to play in this decisive battle, as our speaker has mentioned. And with collective efforts, we can make a very significant impact. So thank you all very much once again for your participation and engagement.
Thank you very much.
We really look forward to seeing you in our future events and initiatives. Please, let's continue to work together towards a healthier and hepatitis-free world. I hope you have a wonderful evening. Thank you all very much. Stay safe.
Thank you, Mr. Bright.
Okay, bye-bye.
Thank you.
Thank you, sir.
Thank you very
Thank you
much.
all. Thank you all.
Thank you very much, sir.
The meeting has come to an end. Thank you very much, everyone. Thank you. Thank you. Thank you.
Thank you also.